Do you feel a constant pressure in your chest? Is there an unexplained pain in your left arm? Or do tasks you used to do easily now leave you breathless? If you're over 50 and dismiss these symptoms as normal with age, you may actually be missing your body's most serious warning signs. According to data from the Centers for Disease Control and Prevention, someone in the United States has a heart attack every 40 seconds. Most of these attacks result in death because the symptoms go unnoticed, even though the heart is signaling days or even weeks in advance. Hello, I'm Dr. Lyra Benton. Welcome to my channel where I focus on urology and men's health. Don't forget to follow, like, and share your comments. Today we'll detail 5 critical symptoms men over 50 should be aware of. These are the warnings your body whispers to you, but most men don't hear. Finally, I'll share life-saving steps with my 60-second emergency action plan, which will only take you a minute. Feeling of pressure, squeezing, or fullness in the chest. Chest pain is the most classic and dangerous symptom of a heart attack. It usually manifests as a pressure, squeezing, or burning sensation in the center or left side of the chest that lasts for several minutes and sometimes comes and goes. This feeling is the same discomfort described by those who say, "There's a weight on my chest, like an elephant sitting on it." The American Heart Association states that this feeling is a clear indication of reduced blood flow in the coronary arteries that feed the heart. When the heart muscle doesn't receive enough oxygen, permanent damage occurs within minutes. Therefore, waiting for pressure or burning in your chest, thinking it's gas pain, is actually silencing your heart's scream. Atherosclerosis, cholesterol buildup, and high blood pressure are more common in people in their 50s. Chest pain is no longer just a sign of fatigue. On the contrary, it can be the first sign that the heart is straining. The Centers for Disease Control and Prevention emphasizes that such chest pressure in men over 50 should not be taken lightly. Every minute of delay means irreversible damage to the heart muscle. Pain or discomfort that can radiate to the upper body, arms, back, neck, jaw. Heart attack pain is sometimes felt not only in the chest, but also in other parts of the body. Pain that radiates to the left arm, both arms, neck, jaw, or upper back is usually cardiac in origin. Some men describe it as a heaviness in my left arm or a stiff jaw. This is a sign that the heart muscle is struggling with oxygen deprivation. The American Heart Association explains that this type of pain is caused by the nervous system reflecting the areas where the heart is not receiving oxygen. During a heart attack, nerve networks can cause referred pain in areas outside the chest. If this pain begins suddenly and has no other explanation, it may be a cardiac signal, not a muscle pain. Muscle, shoulder, and neck pain are common in the 50s and older. Therefore, many men may interpret this pain as joint stiffness or muscle fatigue. However, many people who have had a heart attack simply say, "My back hurts," before arriving at the emergency room. Therefore, unexplained pain felt outside the chest should be taken seriously, especially in men over 50. Shortness of breath, at rest, or during light activity. A heart attack doesn't always begin with pain. Sometimes the first symptom is unexpected shortness of breath. A feeling of "I can't breathe" or "I can't take a deep breath" can occur even when walking or sitting. The World Health Organization states that during heart failure or a heart attack, fluid builds up in the lungs due to the decreased pumping power of the heart, causing shortness of breath. According to data from the Centers for Disease Control and Prevention, 1/3 of men who have a heart attack first experience shortness of breath and then develop pain. Shortness of breath is a sign that the heart is unable to cope with the lack of oxygen. This symptom is one of the silent but clearest signals of the body's alarm system. Smoking history, lung disease, and excess weight can make shortness of breath common after age 50. However, new-onset shortness of breath or shortness of breath that occurs at rest can be an indication that the heart is straining. This is particularly true in painless heart attacks, also known as silent attacks. Even if you don't have chest pain, if you're experiencing difficulty breathing, you shouldn't wait until a cardiac cause is ruled out. 4. Sudden cold sweat, dizziness, lightheadedness, and weakness. During a heart attack, the body releases excessive stress hormones in response to decreased blood flow. This can manifest as sudden sweating, dizziness, lightheadedness, fainting, or weakness in the legs. Many patients who report, "I suddenly broke out in a sweat, my hands and feet went numb," are actually in the first minutes of a heart attack. The American Heart Association states that these symptoms indicate that the heart muscle is not receiving enough blood, leading to electrical imbalances. This can lead to arrhythmias and sudden cardiac arrest. Also, during a heart attack, blood pressure can drop suddenly, and the insufficient blood flow to the brain can cause dizziness or fainting. The risk of atherosclerosis and blood pressure problems increases with age. These symptoms are often dismissed as, "I'm a little dizzy," but these warning signs are actually signs that the heart is no longer pumping enough blood. Therefore, if you experience an unexplained cold sweat or sudden weakness, seek immediate medical attention instead of simply saying, "I'll just rest for a while." 5. Nausea, vomiting, indigestion, or a burning sensation. A heart attack doesn't always manifest as chest pain. Sometimes it begins with symptoms thought to originate from the stomach. These include heartburn, indigestion, nausea, vomiting, or a burning sensation in the upper abdomen. According to Mayo Clinic experts, when blood flow to the heart muscle decreases, the pain radiating to the diaphragm can feel like stomach discomfort. This is why the early stages of a heart attack can be misinterpreted as upset stomach. The American Heart Association also emphasizes that these symptoms, especially in men, can be signs of a silent heart attack. Because men often experience stomach problems, they often dismiss them as serious. However, recurring nausea or a burning sensation at times unrelated to digestion can be a sign of a heart attack. Gastric reflux, gastritis, or stomach problems are common in men over 50. Therefore, any stomach pain is considered normal. However, pain originating from the heart can also refer to the stomach. A burning and pressure sensation, particularly in the area between the chest and abdomen, may be circulatory rather than digestive. In this case, immediately contacting an emergency room can save lives. 60-second emergency action plan. With heart attack symptoms, every second counts. As the American Heart Association states, every minute that passes means a portion of the heart muscle dies. Therefore, it is vital to take the following 5 steps within 60 seconds of the onset of symptoms. Call 911 immediately. Do not attempt to drive yourself. Emergency crews can respond en route, saving time. Stop moving and remain calm. Sit or lie down. Breathe deeply and slowly. Panic increases the heart rate and worsens the condition. Take aspirin, only if your doctor recommends it. If your doctor has already recommended it, you can take a 325 milligram chewable aspirin. Do not take it if you have any allergies. Do not smoke, drink caffeine, or drink alcohol. These increase the heart's rate and oxygen demand. Remember the time your symptoms began. This information will help emergency medical teams expedite the treatment plan. Remember, time is the heart. Every minute reduces the chance of heart muscle recovery. Conclusion and a valuable reminder: every man over 50 is a legacy to society. Their experience, hard work, and the value they add to their family and community are important not only for their own health, but also for those around them. Therefore, taking care of their heart health is not a choice, but a responsibility. The World Health Organization states that heart disease can be prevented by 40% through regular checkups, a balanced diet, exercise, and quitting smoking. The American Heart Association emphasizes that men who recognize the symptoms early have a 3-fold higher chance of survival after a heart attack. Remember, the content I share here is for general health and educational purposes. A heart attack may progress silently, but its symptoms are never silent. Chest tightness, shortness of breath, unexpected sweating, arm or jaw pain, nausea. Don't say, "It'll pass," if you experience even one of these, because sometimes it doesn't. Your own life can depend on a phone call. If you found this video helpful, don't forget to like it, share your thoughts in the comments, and subscribe for a healthy, balanced, and strong life. See you in the next video with some amazing topics. Take care. Stay tuned.